Greetings, it's Regina E., and welcome back to my YouTube channel for Black women over 60 who live alone. But before I start, go ahead and like, subscribe, and hit that notification bell so you will be alerted the next time I'm online. Today's topic is going to be my self-care month. November is my birthday, and I always use this month to take care of all my healthcare exams. The mammogram, the pap smear, the physical, including complete lab work, eye exam, and the dentist. So why is this important? Well, breast cancer is the #1 cancer for women. If a woman is going to be diagnosed with cancer, more than likely it's going to be breast cancer. Breast cancer is the second leading cause of death for women. The second leading cause of death. I don't know what the first is, but it is the second. Also, Black women it's even higher for Black women. Black women have a 40% higher likelihood of dying of breast cancer than our white counterparts. And according to Dr. Vivia B. on the Karen Hunter YouTube show, titled Black Women and Breast Cancer, she said there's many reasons why the rate is higher. One of the reasons she says is the environment. Some and many Black women live in toxic environments where the air and the water is filled with chemicals. And they live in food deserts where they don't have access to adequate healthy food. They have more access to processed food than they do fresh food. So that's a contributing factor. Another reason Dr. B says is that we have more comorbidity issues. We have the diabetes, the obesity, and the high blood pressure. And that's another contributing factor for breast cancer. Also, she says that a lot of women think that if they don't have breast cancer in their family, then the likelihood of getting breast cancer is low. And she said that's not true. The other factors, the environment, the comorbidity, and factors increase your chances of having breast cancer even if you don't have it in your family. So if you want more information on the statistics of breast cancer in Black women, definitely go watch the show Karen Hunter YouTube video with Dr. B, Vivia B, Black Women and Breast Cancer. Also, I have my yearly pap smear. And even though I'm not 65, I still get a yearly pap smear. After 65, unless you've had some abnormal pap smears, you can stop getting the pap smear. You don't need to get the cervix checked, because I guess the rate of cancer goes down after 65. But up until 65, even if you're not sexually active, you still need to get your pap smear to check for any pre-cancerous cells, or to make sure everything is going okay up there. Also, you need a yearly physical, and that includes lab work. And make sure you get a fasting lab, a full lab, including a urinalysis. A urinalysis will check your kidneys, your liver, and your mineral levels in your body. The fasting lab work checks for diabetes and cholesterol, and yeah, I think that's it. Well, there might be other things, but that's all I can remember. So make sure you get at least a yearly blood work. Sometimes your doctor may ask for blood work every 6 months, depending on what your levels are. I get my eyes checked once a year. I wear glasses, so it's important that I get my eyes checked. Number one, to make sure I stay up on my prescription, make sure they're still good, and to check on my cataracts. I found out that we all have cataracts, and as we get older, the cataracts just grow and grow. And at a certain point, we will have to have cataracts removed. And cataracts is a film on your eyeball. It's a cloudy film that covers your eyeball, and it makes it hard to drive at night. Sometimes you have blurry, a double vision, and it could cause watery eyes. So make sure you get your eyes checked. Even if you don't wear glasses, get your eyes examined once a year, especially if you're over 60, and keep up on those cataracts. Also, I get my teeth clean. Traditionally, your teeth should be cleaned every 6 months, but I go every 4 months because I have receding gum line and I have large pockets in my teeth because I have a lot of crowns, and that causes the gums to recede. So I have my deep cleaning every 4 months to make sure that they're not getting worse. So that's all the exams that I do in November. And like I said, I try to get them done in November, at least get them scheduled in November. So I have the rest of the year to relax and not have to think about those things or remember to schedule them. And my motto is sneak up on disease before it sneaks up on you. So again, pick a month, any month, get your exams, and don't forget to get the results. Don't forget to get the results and discuss them with your doctor, physician, because early detection is the key. Early detection is the key. So I hope you enjoyed this video and maybe learned something, and you might be able to tell me a few things. If so, leave a comment below. And again, like, subscribe, and hit that notification bell. And I will see you next week, and I'm going to talk about other ways that I take care of myself during my birthday and all year long. Thanks again. Namaste.